Beyond the trip, beyond the haze, we're lighting up these shadow waves. Ketamine dreams to...
Welcome back to Conscious Healing, Beyond the Trip, hosted by Dr. Jason Harris. Each week, Dr. Harris explores the world of ketamine and other psychedelics, uncovering how they're helping to treat mental health conditions and chronic pain disorders.
This podcast is intended for educational purposes only. The information shared should not be considered medical advice. Always consult with your physician or a qualified healthcare professional before making any changes to your medication or treatment plan. Please be aware that some of the substances and treatments discussed on this podcast may be illegal in certain jurisdictions. We do not endorse or encourage the use of illicit substances. Welcome to Conscious Healing Beyond the Trip. I'm Dr. Jason Harris, an emergency medicine specialist with a passion for exploring the therapeutic potentials of ketamine and other psychedelics. In this podcast, we dive deep into the medical, psychological, and transformative aspects of these treatments. Whether you're a seasoned practitioner or curious about alternative healing methods, join me as we uncover insights and stories that go beyond the ordinary. Today, we're going to debunk the most common myths surrounding ketamine. These are big questions that we get, we hear, we have to answer with almost every single patient. So I'm sure many of you out there are thinking the same thing or have heard the same thing and want to know what the answers are. Myth number one, ketamine is just a horse tranquilizer. This is the most common thing that I hear. It's classic stigma. Ketamine was first approved by the FDA for human use in 1970. It is currently on the WHO's list of essential medicine due to its strong safety profile as an anesthetic. The dose and purity is completely different than veterinary medicine. What they use is ketamine, but it's not the same. And the reason that it is given to animals, just like in humans, is because it is so safe. So yes, it is used in animals, but it was first used in humans. Myth number two, medicinal ketamine is the same as the street drug Special K. Okay, so they're similar, but it's like comparing a surgeon's scalpel and a rusty knife. Yes, they can both be used to cut, but they're completely different. Medical ketamine is produced in a sterile lab with a guaranteed purity and dosage. It's administered by medical professionals such as myself in a monitored setting. Special K is illicitly produced with no quality control. It's often cut with dangerous adulterants, so you don't know what you're getting. They could be mixing in fentanyl. You have no clue. So the risk of Special K are due to the unknown dosages and the contaminants that are in the street drug Special K. Myth number three, ketamine's highly addictive. While frequent high-dose recreational use can lead to a psychologic dependence, the dose that we used in a medical setting is low compared to what's being used on the street. We have set protocols, and it does not produce a physical withdrawal syndrome when patients stop using it. So say you come in and you have X number of treatments and you're like, oh my gosh, I'm feeling better. I don't think I need to use ketamine anymore. You're not going to have any withdrawal symptoms like you would with alcohol, benzodiazepines, opiates. You're just going to go back to feeling the way you were before treatment started, assuming that you haven't changed your life and changed how things go, still going to counseling, because patients can come off ketamine and be better due to the way it works, which we're going to get into here in just a few minutes. All right, so the next myth that we hear all the time is ketamine therapy is just a temporary high with no lasting benefits. The therapeutic effects are not tied to the acute setting of feeling high. The real magic happens at a neurobiological level. Ketamine works on the glutamate system. It triggers a cascade that increases the levels of brain-derived neurotropic factor. Lots of big words. BDNF is what you'll see it shortened to. The BDNF, the cascade that it produces, it promotes synaptogenesis. We have synapses in our brain, and it helps to produce more of those synapses. More synapses mean that the brain can talk to each other better. And then it also promotes neuroplasticity. What neuroplasticity is, Think about a bodybuilder. They work out, they work out, they work out, they get these big muscles. Neuroplasticity does the same thing. It makes the neurons grow, which allows more information to be passed back and forth, which creates new connections and helps to rewire the brain. All of this together improves mental health symptoms long after the medication has left the body. You get a treatment and come back for a booster 6 weeks later, and it's still working for you. But you can notice that it's probably starting to wear off a little bit. That's how it all works. All right, myth number 5, you must have a psychedelic or out-of-body experience for it to work. No, 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 no. This is what I try to explain to my patients. They think, oh my gosh, I didn't have that out-of-body experience. It's not going to work for me. That is not true. Some studies have shown a correlation in the intensity of out-of-body experience with improvement. I really think that's just a placebo effect because we're seeing lots of studies that show that the ketamine works at a subdissociative dose. Dissociative is that out-of-body experience we see when we use higher doses. It's because the BDNF is activated at lower doses. It's activated at higher doses, but it also is activated at lower doses so that you're not worried about that dissociative state. So you do not have to have an out-of-body experience for the medication to work. And that's the hardest thing for my patients to understand sometimes because they're like, oh, I didn't feel the same way. It doesn't matter. The dissociative state is a side effect and is not necessary for the medication to work. All right, myth number 6, ketamine will destroy your bladder. So there is something called ketamine-induced cystitis, which is inflammation of the bladder. It can lead to hematuria or blood in the urine. It's only seen with high-dose chronic recreational use. It's very rarely seen in the clinical setting. So yes, it's real. Yes, it can happen, but it usually only happens at higher doses. All right, myth number 7, ketamine is only a last resort for the most severe cases of depression. So yes, initially when ketamine was started to be used, it gained fame. That's what we were using it for, treatment-resistant mental health disorders. Now it is an option for those who have failed 1 or 2 medications. We're seeing studies that it's even better in early use. If you have somebody that has suicidal ideations that want to harm themselves, we can give it and it has a rapid effect, which should make it a first line and not a last resort. Studies are showing that patients with a shorter history of mental health symptoms, if we start this sooner in the treatment regimen, we're getting better results than patients who have been depressed for 30 years and they've tried every single antidepressant out there and nothing is working. We have a much harder time getting those patients better than we do somebody who's only had depression for a year or 2 and have only tried 1 or 2 medications and then they come see us. So the sooner we start, the better results that we're seeing. Myth number 8, ketamine just sedates you so you don't feel sad. Ketamine blocks the glutamate NMDA, so N-methyl D-aspartate receptor. It blocks those receptors. Blocking this receptor is called a surge of glutamate, activates the other pathways, enhances neuroplasticity, and the brain creates new, healthier pathways. We've already discussed how the NMDA works, so I'm not going to expand on that. But myth number 9, any doctor can prescribe and administer ketamine. Legally speaking, yes, anybody can write for it. It is a off-label use, so anybody can do it, but it should be given in a reputable clinic by a physician with specialized training. They have protocols set in place. They have vital signs monitoring. I hear this all the time. They say, oh, I went to so-and-so and they gave me a treatment. And I was like, oh, okay. And then I'm hooking them up. They were never placed on a cardiac monitor. They were never placed on a pulse oximeter. They didn't have their blood pressure checked. These are all things that can happen when you receive IV ketamine. So you should be as safe as possible. So it should not be done without proper clinical infrastructure, such as we have at Transformative Wellness. Myth number 10, ketamine therapy is one and done cure for depression. So nope, it's not a single magical bullet. You're going to come in and do an induction treatment course. With us, it's 2 to 3 treatments every week for 6 treatments. My preference is Monday, Wednesday, Friday, Monday, Wednesday, Friday. We get 3 done each week. And then you get a 2-week break and you come back for a booster. You get a 4-week break after that, and you come back for a booster. And most of our patients are coming back every 6 to 8 weeks for boosters. You also get better results with ongoing psychotherapy. You want to continue doing psychotherapy because the ketamine is helping produce more synapses in the brain. They're helping with the neuroplasticity, which is going to help you form a new neural network, which with psychotherapy can help treat your symptoms. Myth number 11, ketamine is neurotoxic and causes brain damage. In old studies in rodents with frequent high doses, they found lesions called Olney's lesions, Olneys, Olney's lesions. These lesions have never been replicated in humans at therapeutic doses. The new studies actually believe that ketamine improved synaptogenesis and the neuroplasticity that we discussed earlier. So it actually helps the brain. It doesn't hurt the brain. Myth number 12, at-home ketamine treatments from online companies are just as safe and effective. This is highly controversial and very risky. In the clinic, it's going to be safer because you've got a physician in the clinic. You've got staff that monitor your vital signs that are there in case there is a medical emergency, because ketamine does have side effects. It can raise your blood pressure. It can cause you to disassociate, which could lead to you freaking out and hurting yourself if you're at home alone. So obviously safer if you're doing it in the clinic. When you're at home, your lack of supervision increases the risk of medical emergencies. Another side effect is laryngospasm. Your throat can spasm up and close up, and that can cause all kinds of severe problems because you can't breathe. Myth number 13, medicine does all the work for you. Nope, it does create a powerful window by lifting the depressive fog and increases neuroplasticity and synaptogenesis, but it is most effective if you combine it with psychotherapy and changing your old habits. So it's not just done alone. We do recommend that you do psychotherapy, that you work on yourself, changing those habits. Myth number 14, nasal spray Spravato, which is identical to IV ketamine. Ketamine itself is what we call racemic, so it has two compounds in it, S-ketamine and R-ketamine. Spravato only contains the active molecule S-ketamine, so it only has one of the ketamine compounds. Not to say that one is better than the other. The studies are fairly close. I think IV ketamine, because it does have a 100% bioavailability. Bioavailability means that is the amount that gets to the cells in your brain that we want to target, whereas Spravato is only about 48% bioavailable. Studies vary. There's not been a head-to-head study between IV ketamine and Spravato to show one's better than the other, but the studies with ketamine have shown that it works about 85% of the time to decrease symptoms, whereas Spravato is about 70% of the time. Ketamine is a new and unproven fad in mental health. All right, so it's not new. It was approved 50 years ago. The first major study of ketamine was done at Yale University in 2000. So that's 25 years ago, so it's not new. And then the FDA approved S-ketamine, Spravato, in 2019, which cemented its role as a legitimate evidence-based tool to treat depression. And, for IV ketamine, it treats other mental health disorders besides depression. Number 16, ketamine will make you lose control or have a psychotic break. In a therapeutic setting where we've done coaching, we've explained to the patient, this is what we're going to do. We start at a low dose and slowly increase, at least here at Transformative Wellness, we slowly increase till we get to that max dose that is just, I talk to my patients, we slowly increase our dosage till we find that max therapeutic dose for the patient. And that's basically, oh my God, that was perfect. It felt great. I didn't have any side effects. You usually will not have a psychotic break. Now, that's not to mean that it hasn't happened. We have had patients who have dissociated and gone into the K-hole. K-hole is what they call it, ketamine hole. My goal is for my patients to stand on the edge of the Grand Canyon, looking in, seeing how beautiful it is, but not jumping off into the Grand Canyon, into that K-hole. We try to provide a calm, safe, and supervised experience. And then our patients are usually awake and communicate Lower doses help to decrease that dissociative effect. Most of my patients describe their treatment as a vivid, dreamlike state, and they never felt out of control. So that's our goal. We want that vivid, dreamlike state, but no loss of control. If there was a emergency at the clinic, they could get up and we could assist them out. They're not going to be completely unconscious. Myth number 17, ketamine is an opioid. This is a critical and dangerous falsehood. Opioids like morphine and fentanyl work on the mu opioid receptors. Ketamine works on the NMDA glutamate receptors. They're a different class of drug. They have a different mechanism of action. They're not addictive like opioids. They're not going to have a withdrawal period after you stop taking them like you would opioids. In fact, because of its potent pain-relieving properties, without the dependence, ketamine is being used to help treat chronic pain. We have quite a few patients that come to see us, and even their mental health dose, they tell me, oh my God, my pain is so much better. I'm not having the pain I was having before. Because a lot of times, as you know, mental health disorders can present, or one of the side effects is that chronic pain, or pain symptoms. So yeah, no, it is completely different than an opioid. Now, it is a scheduled medication, which means that we have to do lots of stuff to track every dose, every bit that is given, but it is not an opioid. Myth number 18, insurance never covers ketamine treatments. Now, this is rapidly changing because we do see every now and then patients get some reimbursement from their insurance company after treatment. The reason for that is it's an off-label use. Ketamine was developed 50 years ago. It is generic, so no drug company is going to spend the money to go out and do a trial, because those cost millions and millions, hundreds of millions of dollars to get a on-label for ketamine. You're not going to get it on label. You're not going to get an FDA approval for ketamine, because why would you spend that money when it's generic and anybody can produce it under the generic label, right? So that is why even though it works, even though there's all kinds of evidence based out there that shows that it works, nobody's going to spend the money to make it on label with FDA approval for IV ketamine. Plus, it's very hard to do these trials, because if you get saline in one person and you get ketamine in the other, you're going to know. You're going to know that you didn't get a psychedelic, that you didn't get some kind of medication, because you're not going to feel anything. So it's very hard to do a double-blind randomized control trial. Now, Spravato, Janssen was able to do the study, take ketamine, use it as a nasal spray, and get FDA approval for major depressive disorder. And that is why Spravato is covered by insurance and IV ketamine is not. Number 19, ketamine works instantly. So yes, it does have a rapid acting profile compared to traditional antidepressants. I mean, we're talking 2 weeks rather than 8 weeks. I don't usually see a huge improvement immediately. Usually I tell my patients it's going to take 4 to 5 treatments before you notice a difference. My patients' families are going to notice it before them. They're going to say, oh my gosh, something happens and they usually react this way. This happened and they did not react. So, and that's usually around number 3. I've had a couple people that come in after the first treatment and they're like, oh my gosh, I am so much better. Now, is that the placebo effect? Was the ketamine really that effective? Because, I mean, in studies, it has shown that within 72 hours, it does start producing those antidepressant effects. Like I said, patients often see improvement in 1 to 2 weeks rather than the 6 to 8 weeks with oral medications. Number 20, you have to stop taking your other antidepressants to use ketamine. This is not true. We actually want you to continue your medication, because if we're hitting that depression on multiple fronts, all right, we're using an SSRI and we're using the NMDA receptor antagonist like ketamine, it works together to help you feel better. So why would we want to stop taking a medication if it's working? My recommendation is do not ever stop your depression or your antidepressants without talking to your ketamine provider or your psychiatrist or whoever is prescribing your antidepressants, because that combination is what's working for you. If you stop one, everything may stop working. Have that discussion with your doctor. Have that discussion with your, whoever is writing for your medication and providing your ketamine therapy, so that we don't go backwards and undo everything we did. All right. That was the 20 most common myths that we hear. If you have more, if you have other things you want to see me answer, drop them below in the comment section, and I can do a follow-up to this, because there's so many more. But these are the 20 most common that we see. Please stay tuned next week for our next episode, where I'm going to discuss how psychedelics work to help with treatment-resistant mental health disorders. This podcast isn't medical advice. It's a conversation, one that's evolving. So talk to your doctor, ask hard questions, but remember, your provider might not be up to date on the latest research, or might be closed-minded to the use of psychedelics, even though the science is there. Stay skeptical, but stay open-minded. Sometimes the most healing paths are the ones we nearly forgot. Thank you for joining me on Conscious Healing Beyond the Trip. I'm Dr. Jason Harris. Until next time, stay curious and stay informed.